According to statistics released for the 2024 budget, the total budget for that ministry is 1.23 trillion. The recurrent expenditure is 793.3 billion. The capital expenditure is going to be 434.7 billion. The capital projects to be implemented will be 1,573. Out of this, you have new projects to be 976. And the ongoing one to be 597. To provide a better perspective to these and to help us analyze the budgetary projection for the Ministry of Health, we have a special guest in the studio. We have Dr. Tuyi Mebawondu. He's a public health practitioner and the founder of Health FM. Glad to have you join us on NXT this morning.
Happy New Year. Happy New Gregorian Year.
Interesting.
Gregorian Year.
Yeah, that's it.
Gregorian New Year.
That's great. The last time we had this conversation was last year.
So, how time flies.
Yeah,
we found out that when a year is not a leap year, it runs so fast.
Yeah.
But today, this year is a leap year. So those guys that were born about 4 years ago, February 29th, 4 years ago, they'll be 1 year. They'll be 1 year today. They'll be 1 year this time around.
All right, let's start with the 2024 budget itself before we get down to that of Ministry of Health. You know, you have a projection of 28.7 trillion naira for the 2024. The president submitted an appropriation bill of 27.5, but the National Assembly, in their own wisdom, felt it was needed to increase it. You had an increase of 1.2 trillion. And if you look at the benchmark, you know, $77 and then the exchange rate of 750 naira to a dollar, I would like you to quickly react to this projection. How optimistic are you with this kind of budgetary allocations?
First and foremost, I am not an economist. I am not a budget expert, but I am a common sense person. These are just projections. And the reality of the projection, even recently, we have to cut our oil production, which is actually the main foreign exchange earner for us. And you know that, of course, it's still a deficit budget. We're still going to borrow as much as up to 7-9 trillion to bridge the gap. We're going to sell some assets, national assets, to run the budgets. And then the projections on what the budget runs is queried, is actually, you know, not so solid a foundation. But having said that, I hope that people who understood how budget should be run will be able to manage it. But if the output is going down, of course, they're thinking of probably a little increase in the price of crude, which, of course, a lot of people are competing to supply the crude. We just hope that the stability will continue in Niger Delta to give us sufficient crude, and then the crude price will be very stable to be able to fund the budget. But how I wish that we have some other realities to use to fund the budget. But it is the budget, and of course, you know, the budget performance, most of the time we rarely get to 60%. We rarely get to 60% because it's not just the budget, you have to release the money, you know. And then if the money is not released, how do you now, you know, implement the budget? And of course, we've been complaining that the budget for Nigeria is too timid. You know, we expect a country like this to be running ×4 of that sort of budget. They're too timid for the population, for our aspiration. We hope things change.
All right, let's start from the point of aspiration now. There are projects that will be embarked upon this year. There are ongoing ones, and then there are also new ones. But top 5 capital projects have been highlighted, and among them we have Immunization Plus and Malaria Progress. We also have the special intervention for revitalization of primary health care. In the order of priority, how do you find this?
Well, again, for us, in 2001, the Abuja Declaration told us clearly, even in our own country, we agreed to put 15% on health. I remember my teacher, Professor Campbell in Harvard University, said that, he said, you want to change the health system, follow the money. Now, that's why it's become important to have conversation around budgets and your intention. Now, if you look at Nigeria's socio-economic reality, even this 1.2 or 1.3 trillion allocated to health is still very small amounts of money, because last year it was 1.17, and then that was when dollar was a bit reasonable. And most of this input you are going to put into the revitalization of primary health care, immunization. Actually, what you are doing for immunization is what we call counterpart funding. Gavi is going to provide the immune, those things, and then you do your counterpart funding so that you can then be able to immunize. Now, they're not sufficient, because you look at our immunization schedule, we're barely 54% coverage in immunization. So that's not what we want to do. Immunization is one of the key things that can help us reduce childhood deaths. We know our reality in that regards, and then of course, give time here to children to achieve what they want to achieve. So immunization is a key issue there. So it's good that they have chosen to allocate money to immunization. Our prayer is that the money will not get whacked, okay? Because it has happened in the past that money that was given for immunization was mismanaged, and we had real problem. Now, the second thing is the primary health care center. Of the 30,000 primary health care dotted all over Nigeria, just barely 8,000 are working. Just about 2 weeks ago, I had a trip to go and assess one primary health care center in the Niger Delta area. I can tell you the place was locked up. Okay, the primary health care center was locked up, the roof was not there, nobody was there, the whole was smelling. When we finally got access to the place, and I asked, and even the person operating the primary health care center is an indigenous of the place, and I wonder, there's a difference between you budgeting, you releasing the money, and the money achieving what you are. And we've always been shouting, are we getting the right, bang for the bucks we're putting there? So if you are 200 or something thousand, the lowest hanging fruit you have is your primary health care center, okay? That one is nearer to somebody, okay? And then we really have to deepen the utilization and increase the number. Of course, you know a lot of things that is dealing with that. Finance is still an issue there. Human resources is still an issue. Process optimization is still an issue there. Insecurity is an issue in all this area. So, for me, health has moved beyond drug and all these things. We have to look for what I call a multi-sectoral collaboration to drive all these things. So, well, it's good if you budget for those things, but if you do, like it's something for the whole primary health care center in Nigeria, what do that amount to? But of course, we have the basic health care fund. That is 1% of the consolidated salary revenue of the government. This year is going to get about 100 and something or so billion. We'll see how far that one can be applied. The big elephant in the room is the application of even this tiny fund. Is the application. That's the big elephant in the room. Because the psyche of everybody is that where is the money to take? Where is the money to use? And then, lo and behold, many years, our health realities is not, quite reflecting the money we're spending. We're still having as much as more than 800 women deaths, okay, per 100,000. We're still having as much as 70 infant deaths, and as much as 100 and something under 5 deaths, per 1,000 births. That's a lot. Those things are scandalous. Our infection is still very high. Malaria is still killing, as much as we can, think of. Lassa virus outbreak is there. We cannot respond appropriately to any emergencies. And then recently, just yesterday, the news broke that the biggest syringe and needle manufacturing concern in Nigeria stopped functioning, stopped working. The company packed up. So when Party came and started giving this 4-point agenda, agendas are usually very good. They're smooth. Pull. 1, 2, 3, 4. But one of the agenda is actually to help manufacturing, to help what I call health consumables and all those things. But the biggest thing is a needle in Nigeria. I don't want to mention the name because they don't pay you. Packed up. So if you don't manufacture ordinary syringes and you do manufacture ordinary gloves, you have to import with $1 that is above 1,000. So it's a huge issue. It's a huge issue. I think we really need to rethink the funding and budgeting process for health. I'm sure we'll get there. Even let me just mention it. Because what we tend to do now is do what we call line budgeting. Guys bring item, you allocate money to those line budgeting. For me, what we should have been doing is to really rethink budgeting instruments. Okay? Now, apart from line budgeting, we can do a critical budgeting to free bottleneck, marginal budgeting for bottlenecks. Because the health system had bottlenecks. It has bottlenecks.
In what areas?
It has critical gaps. Okay? There's a big bottleneck as far as infrastructure is concerned, for instance. There's a big bottleneck as far as human resources, both in training and deployment is concerned. There's a big bottleneck in terms of process, health process, the flow of the process, you know. Those are huge bottlenecks that you have to budget to free for you to be able to see the effect of the health. But we're doing line budgeting all the while, and line budgeting it's just line. Okay, it's just line. Well, they have a good team. I mean, in terms of Alipate, Hiri in National Health Insurance Agency, another Oni also in National Private Healthcare Development Agency, and Sonny, is it Sonny, as the Minister of State. You know, we just hope that something is going to happen.
All right, let me still take you back to this slide, the capital projects. The first on the list is the immunization plus and malaria progress. I want you to give us a true picture of where Nigeria is when it comes to the issue of immunization and malaria, you know, activities or projects, because you're going to have about 57 billion to be spent on this. How do you think this money should be prioritized, and what do you think this money should be spent on? Could it be vaccines, research, or whatever? Talking about the issue of immunization and malaria.
The gap in immunization is in excess of 500 billion. Okay, if you have 50 something for both immunization and malaria, that means that you are just scratching the surface. In reality. So now, this is what happens. You look at counterpart funding. Gavi comes, United Nations, UNICEF comes in, a lot of people comes in, Bill and Melinda Gates comes in, and then you still have to really warehouse all those funding and use. There's a new trend which is now being implemented, is not to be implemented. It's called sector-wide approach. The sector-wide approach allows you to take all the money, warehouse, and spend, and prevent people from doing silos, or what we call focus or lateral funding, where Bill Gates will say, you see, I can only touch malaria. And then Gavi will say, I can only touch immunization. That one will say, no, for me, it's tuberculosis. Japan will say, I can only touch tuberculosis. So what would now say that, okay, guys, bring all this money. These are our priorities. We'll consider them. Let's be able to spread this money sector-wide and look at how to reach it. So first and foremost, as far as immunization is concerned, we're having gaps. Secondly, as far as malaria is concerned, even with that money cannot even cater for the not of malaria. And you know that the strategy for malaria now, I mean, we have a lot of instruments to fight malaria now. Good enough, you know, the vaccine is there, okay? Except you give the vaccine free of charge. But perhaps you incorporate it into the National Immunization Project. Maybe, you know, we'll start seeing the right effect. But key for me is actually the health literacy part of it. You know, because I have not seen the details of how they're going to spend those things on malaria. Are they going to use the long lasting nets? Are they going to use it to procure anti-malaria? Are they going to use for vaccines? Okay? So the component that can really help us deeply is actually the health literacy project, the health literacy part of it. How are you engaging the community, the faith-based organization, the NGOs, everybody, in dealing with malaria, you know, attack or malaria death. So money is being allocated there, but because if you look at it, all these capital projects, they are less than 1/3 of the whole budget. They are less than 1/3. The majority are actually recurrent expenses, which is more than 2/3 of the whole budget. So if you want to implement and you are putting less than 1/3 of the budget that is not sufficient, that's about 5% of the total budget, then, you know, the money will not be sufficient. I mean, for government, they must have to start looking at different funding options. Different funding options. And a clear example is the sin tax. You know, when we say sin tax, smoking, tax on smoking, tax on cigarette, tax on sugar, okay? These are the taxes that are supposed to be warehoused into the Ministry of Health and used to, you know, support health funding. But the tax goes back to federal government and they use it to buy Jeep. So, you and I know, they buy Jeep, they innovate houses and abandon here. And what is even more challenging is the fact that you did, I mean, you know, we had 2 supplementary budgets before this main budget. Nothing for health. Nothing. Nobody considered health as such a priority. Now, you look at the capacity to train. You and I know that maybe 34,000 doctors treating 200 million people, for instance, doctors. I felt the figure for lab scientists, pharmacists are actually lower. Okay? What are you going to do with that? Every day they are carrying their bag and moving away. Okay? We are not addressing the challenge of human resources for health in that space. Yeah, it's huge because you need human resources to even deploy your immunization, to deploy your malaria project. So human resources is very key. And it will have been interesting to see how well they stood to address that concern. But malaria immunization, well, good, because it's going to probably reduce the infants another 5 deaths. I mean, no doubt, if you can really deploy immunization, if you can move closer to 70-80% of immunization as it is, we're going to reduce the maternal, the infant death especially. That is the target for that one. The immunization of malaria is targeting, and of course, malaria, pregnant women, because malaria is one of the things that reduces the blood content and give them low birth weight and even some spontaneous abortion. So that is what happened to the rest of the illness afflicting Nigerians.
Okay, talking about the rest of illnesses afflicting Nigerians, one challenge that the health sector have often battled with is infrastructure, poor infrastructure, and not having enough equipment. Now, for that special intervention to upgrade infrastructure and medical equipment in new federal teaching hospitals in the 6 geopolitical zones would take 22 billion. And also, there is a special intervention to upgrade infrastructure and medical equipment in new 20 federal teaching hospitals, including procurement of cancer equipment and infrastructure and training. So this aspect, this part of the budget that is addressing infrastructure and medical equipment, how much of relief will it bring to medical practitioners?
Well, you know what we're going to do? We're going to come back here in the next 6 months. And review all these things.
And do an assessment.
And review all these things. For me, they are tired repeats. Now, the health structure of Nigeria, yes, it's 3 tiers: the primary, the secondary, and tertiary. Now, our funding system is such that mainly out-of-pocket health expenses, OPHE, okay, as much as 80-something% of our health funding comes from our pockets, okay. Now, I think that a serious change or hope should be how to actually reverse that and reduce and put more money into the health sector from everywhere we're going to do. And the health insurance in Nigeria is doing like, at best, 5% of Nigerians have health insurance. I think that our activity will be geared towards, increasing the health insurance to that effect. It's nice that you want to talk about health infrastructure. Now, one of the major challenges for that is that I'm most likely may actually have to bring variation, budget variation, or so it's sort of supplementary to address this, because the socio-economic reality is such that the forex devaluation of the naira is affecting those budgets you're talking about. And then the level of poverty, is affecting those budgets that you're talking about. the money available will not be much at the end of the day. Now, it's nice to build. I won't stop government from building new federal medical center or building teaching hospitals. But the critical aspect of this work you are trying to do, actually, human resources. Why do I say this? This is a beautiful building, multi-story building. If I put human resources into this place will become an hospital. Now, the question you always been wondering is that, where are the people going to work in these centers you are putting up? Okay, is this such for the building? I remember one of the governors who built, a level 4 hospital. I was shouting all over the place. He had a little accident after just leaving the government, went somewhere in Akwa Ibom. He couldn't go to the hospital, he went abroad. Just a little accident. So for us, I will say the low-hanging fruit is our coning down on those, more than 20,000 non-functional primary health care centers. Okay? Now, why I'm trying to, I understand the fact that you want me to clap for the
I don't know what to clap.
Innovation.
I'm asking what impact will it have on the medical practitioners in ease of doing job and delivering healthcare to the people?
Yeah, what I'm saying is that the fund, because first of all, those ones that are in existence are not properly equipped. Go to Luth now. I don't want you to go so far. Go to Luth. Then you see quite some of the ones have been shut down. Go to Ife Teaching Hospital. Some of those ones have been shut down because there are no human resources. Now you are building a new one. You want to equip them. But you need human resources to work on those ones. What is wrong in actually ensuring that the one we're having are working and properly equipped and properly staffed before we step on and say that we're expanding? Okay, that is my question. I'm not saying that they can, and of course, by the time we come back and assess, you see that those things were just a way to spread money here and there or to satisfy political inclinations. At the end of the day, I've always said it that the greatest threat to health policy is health politics. The politics of health is undoing a lot of things in health policy. And of course, health should have its own politics, but the health policy should be geared towards improving the health of the people. So it's good. Let's see, but at the end of 6 months, let's now see how well the creation of the new federal medical centers and new teaching hospitals will function. Because right now, those ones in existence have serious shortage of human resources.
All right, talking about human resources, let me take that from you since you've gone that direction. You have this development in Nigeria, this Japa thing, not just affecting the health sector, but virtually every sector, IT and related. But let's talk about the health sector, the impact of that. Do you think the federal government could do anything that could be like a game changer, like this budget allocation, if truly in reality they are being allocated to this issue of equipment? Because I know what some of these doctors complained about is the absence of the necessary equipment. That's why they prefer to go abroad, then the welfare and then the operating environment. Now, what do you think government can do to improve the human resources aspect of the health sector and then perhaps, if possible, stop this Japa syndrome?
You have to step in from the training. You don't just wait for me, go and look for money, spend money, pay so much money to train my ward to become maybe a pharmacist, a doctor, or a specialist, okay, in an area, maybe, pediatrician or something like that. And then you now jump in and start to want to control the person. How do you explain that? Because at the end of the day, the salary is being paid to them, can it actually make them comfortable? But if they have reason to go elsewhere and get improved salary, you can't stop them. But for government, now, government says it has 50 billion or thereabout, or 5 billion, sorry. Maybe somebody they increase the 10 billion for student loans, okay? You have to look at the critical areas of health. Now I'm talking about health, let me be biased. I'll say that, guys, are you studying medicine anywhere? We're going to make this provision for you, for your books, this provision for you, for your other equipment, this provision to make you comfortable. But you note this, we give you automatic employment, because that's another thing. I can tell you free of charge here that quite a lot of even the young doctors in Nigeria, government don't want to employ them because they say their salary is too big. Even the tiny salary is big. They don't want to employ them. A lot of them have to actually go call me or call somebody to do housemanship. And you think that we have excess of doctors, but even those ones you are producing 3,000 every year maximum. That's our production capacity. Except people are not start building new University of Medical. So those ones you cannot even utilize them. You understand? You are not using them properly, because normally there shouldn't be anybody in health sector who should be wondering where to work. So government they're not utilizing those people. So once you intervene from that level of training, and you now say that, you know what, and you provide that job, I say, guys, this is your job, you know, because you have a bond with me to serve for the next 5 years before you exit, and in the process you have this training. When you now employ them, remuneration is not just salaries, okay? Because even if I get the money, I'll use it for something. Because these are the key things that government just refuse to think about. Because I will not refuse to implement. I won't say they were not thinking about it. Here we are. I have a house I'm staying. I'm paying for it. You know, in reality, the Federal Mortgage Bank can say that, listen, that's your house. That's your house. What you need to do is that we'll give you this house. You pay little by little over this number of years. That keeps the person there. You can tell those people manufacturing car in Nigeria that, okay, you take this car based on your level. You pay, we'll deduct so time till so number of time. That's it. You know, we can talk to an insurance firm to give you certain money if you get to the point of having children that can support the education of your children in a way. So you look at those things. At the end of the day, people would think twice to abandon such incentives and run abroad and run into problem, okay? Because then it becomes important for them to run abroad. They have to probably get a clearance either from the Medical and Dental Council or from their institutions that they are not indebted to those things. So intervene from that point, and then intervene at the level of remuneration or compensation for them. While I was in Harvard quite some years ago, we were doing what we call performance-based compensation. In fact, we had to, there was a center which was created for that performance-based compensation. You get certain salary to this amount of money, but the more you solve problem, there's a notch on your salary every time. So we've tried to see how to implement that, but of course, you know that everything is politics in Nigeria. Nobody is ready to listen to a performance-based compensation, variables into the whole payment mechanism for health workers.